Part 3C, Private Insurance, the system most working Americans use. If you're of working age, earning too much to qualify for Medicaid, and not yet old enough for Medicare, chances are this is the healthcare system you live in. Unlike Medicaid and Medicare, private health insurance is not run by the government. It is offered by private insurance companies, although the government establishes many of the rules they must follow. For most Americans, there are really only two ways to get it. Door number one, your employer. This is how most working Americans receive health insurance. Roughly 150 to 165 million people under age 65 are covered through an employer-sponsored plan, making it the single largest source of health insurance in the United States. For many people, it feels almost automatic. You accept a job, fill out a few forms during orientation, choose one of the available plans, and health insurance quietly becomes another payroll deduction. What many people never see is what that coverage actually costs. While an employee may contribute around $120 a month toward individual coverage, the total cost of that insurance is often several times higher. The employer pays most of the premium behind the scenes. Family coverage can cost well over $25,000 a year, with employers absorbing much of that expense. That arrangement works well as long as the job continues. One downside of employer-sponsored insurance is that the coverage is tied to employment. Leave the job, retire early, or get laid off, and the insurance usually goes with it. COBRA allows many people to continue the same coverage temporarily, but now they pay the entire premium themselves. For many families, that is the first time they discover what their health insurance actually costs. Like every other part of the American healthcare system, employer plans also vary. Deductibles, provider networks, prescription drug coverage, and out-of-pocket costs can differ significantly from one employer to another. Door number two, buying your own insurance. Not everyone has access to employer coverage. Self-employed workers, gig workers, early retirees, and people whose employers do not offer affordable insurance often purchase coverage through the Affordable Care Act marketplace, either through healthcare.gov or a state-operated exchange. Marketplace plans all provide a common set of essential health benefits. They include hospital care, physician services, prescription drugs, preventive care, maternity care, and mental health services. Just as important, insurance companies cannot deny coverage or charge higher premiums because someone has a pre-existing medical condition. Plans are grouped into four metal tiers: bronze, silver, gold, platinum. The names sound impressive, but they simply describe how costs are shared. Bronze plans generally have the lowest monthly premiums, but the highest deductibles and out-of-pocket costs. Gold and platinum plans usually require higher monthly premiums while reducing what you pay when you actually need medical care. It is really a trade-off between paying more now or paying more later. For many Americans, federal premium tax credits help reduce the monthly cost of marketplace coverage. Those subsidies are based primarily on household income. As of 2026, however, the enhanced subsidies available in previous years have expired. Financial assistance is less generous than it once was, and households whose income rises above certain limits can lose eligibility for premium assistance altogether. The result is that two families buying exactly the same insurance policy may pay dramatically different premiums simply because their incomes fall on opposite sides of the subsidy rules. The people in the middle. This is the part of the healthcare system that serves millions of Americans who fall between Medicaid and Medicare. They earn too much to qualify for Medicaid. They are too young to qualify for Medicare. If employer coverage is available, many enroll through work. If it is not, they shop for insurance on the marketplace. Others purchase private insurance without financial assistance, and some simply go without coverage, hoping they stay healthy because they cannot comfortably afford the alternatives. The bottom line: private insurance is the foundation of healthcare coverage for most working Americans. Unlike Medicaid, eligibility is not based primarily on income. Unlike Medicare, eligibility is not based on age. Instead, Coverage depends largely on employment, individual purchasing decisions, and the ability to afford premiums, deductibles, and other out-of-pocket costs. For many Americans, private insurance works well. For others, it can be expensive, confusing, or difficult to maintain when life changes. Like Medicaid and Medicare, it solves some problems while creating others. Understanding how private insurance works completes the picture of America's three major healthcare systems and helps explain why healthcare reform is rarely as simple as a campaign slogan suggests.